For our next session is it's quite interesting. We're going to have something on stage: wellness, real estate opportunities, and growth. We're going to move on swiftly into our next session. Please put your hands together and welcome on stage Dato Sri Dr. Vincent Tiew, Executive Director, Branding, Sales and Marketing of KL Wellness. Welcome, sir. We have a microphone for you and a clicker there as well.
All right, thank you. Good afternoon, everyone. Before I start off, allow me to extend an invitation for a makan session, food session. On behalf of KL Wellness City, we would like to invite you for our, I'm not going to flash it on here, but my colleagues around, they're going to distribute the invitation poster. An exclusive Japanese food, bluefin tuna, fine dining experience at our KL Wellness City next Sunday. All right, feel free to bring your partner, all right, your husband or your wife accordingly, and join us for this bluefin experience. You have some sashimi, you have some raw, you have some cooked food, etc. all there. Pop by, get to see what's happening to KL Wellness City, but at the same time enjoy quite a unique omakase. All right, so this bluefin fine dining is about 800 ringgit per pax. So it's FOC complimentary from KL Wellness City. So that's what I want to start off first. All right, I have 30 minutes, but I'm going to maybe do shorter. Allow me to introduce myself again. My name is Vincent. I'm one of the company director for KL Wellness City, a project that is actually at Bukit Jalil, the first healthcare and wellness city in Southeast Asia. The first healthcare and wellness city in Southeast Asia. A land in Bukit Jalil, about 26.5 acres township, opposite of Pavilion Bukit Jalil. But today, what am I going to share on stage here? I'm going to talk about wellness real estate. This terminology, it's unique, and I'm going to see whether I make a point. All right, it starts with this. Okay. Now, Global Wellness Institute, GWI, from the States, define wellness, lifestyle, and real estate as homes that are proactively designed and built to support the holistic health of residents. So in short, smart city mobility, smart homes, healthcare with services. All right. Now GWI says that there is the global market value of this market. It's about 397 billion US dollar in the year 2022, and it has grown in the last 2 years before that, in 2020. By a CAGR of 20.5%. That is big, double digit and it starts with 20%. So what is actually this wellness real estate? Does it involve property? Yeah, but it must have elements of healthcare and wellness and all these elements. The one key thing that I want to highlight is that it is about a combination of office, hospital, mixed use, residential, medical, leisure, but it didn't mention about universities. No, it's about a whole city with all these components integrated, interconnected, with creating an ecosystem. It is carefully master planned and carved and designed right from the first day. Not accidentally when you build and you are next to a hospital. Not that accidentally when you build and set up this medical center and then there's 2 hospitals next to you and there's 1 senior living or retirement home next to you, or there's 2 hotels across the road and there is another 2 or 3 senior living. No. It must be a carefully designed township right from the start. So wellness real estate, the top 10 market in 2022. United States, US ranked number 1 with a very huge 176 billion. Some of these figures are humongous, but I just want to start from the global view and then we move on down to Southeast Asia and Malaysia. China ranked 2nd and moving on. Was it because of pandemic or COVID that this actually grew? No, it's actually not really. But surprisingly, yes, during the COVID, etc., every project start to focus on wellness. In the last 12, 24 months, I keep on seeing so many talks organized by so many hospitals and property developers. Whatever they do, they put the word wellness there. Whatever they design, whatever program they do, they add the word wellness there. Try to think back 3 years ago, was such word or not? The definition, the word wellness was not used at all. At all. Nobody bothered, don't even know what the heck is that. Alright? Now, so global wellness economy 2024 reveals that wellness economy reached a new peak of 6.3 trillion globally in 2023, projected to grow to nearly 9 trillion globally by 2028. So what are these sectors? Such a big figure. Sometimes we wonder, I want to count $1 million US. We don't have that suddenly you go to someone's politician house and then uncover $52 million US. Alright, or ringgit. But see, mental wellness, it's 181 billion market value. Personal beauty and care, 1 trillion. Wellness tourism, 651 billion US. Physical activity, then you have the public health and prevention and personalized medicine. Alright? Aesthetics, etc., all that start playing a big role. I see a lot of GP clinics start doing a lot of aesthetic related services, I guess, I call them. And also health, eating, nutrition, weight loss, 1 trillion. Global Wellness Institute, now go back to the actual definition. To be fair, this is their definition. It's the active pursuit of activities, choices, and lifestyle that leads to a state of holistic health. So you have physical, mental, spiritual, emotional, social, environmental. But the key thing here is the trend moving forward. 2 years ago, when I gave a talk at the ASEAN Forum in Jakarta, this year Malaysia is the host, there was only one company that was invited by MIDA, MITI, to represent Malaysia, to share to the ASEAN countries, the finance ministers, the health ministers, and the trade ministers. There was only one project that was actually picked from Malaysia to present on stage, sharing to a couple of hundreds of these key opinion leaders and policy makers and financial leaders and the ministries. I realized that each of the countries when they picked, they were all touching about healthcare, and we shared about Tiew University, of course, which is why we were invited. So to showcase and explain what is moving on in the next 5 years. 2 years ago, next 5 years, what will you see in Malaysia? So opportunity for doctors here is what? It's a new healthcare delivery platform. Integrates homes, communities, and healthcare access. So are we talking about apps? Maybe. Creates demand for preventive medicine, chronic, rehab, mental. Start having a couple of centers, very popular in Singapore now. Philippines started in a big way. Malaysia, yes. But a lot of doctors still not too sure, I want to do this, I don't know how to do this. What am I supposed to do with it? I'm not so busy with my own clinic already. Or I'm still in the government sector. How can I get involved, start getting involved with this? So, home, hospital, clinic, telehealth, wellness, this is all in the game. Alright, now the importance of medical tourism. Allow me to do this. The medical tourism, it's something that is what Malaysia is going to reap. We have been the global leader in the past couple of years. And last year, again, we won the first rank and first position globally. Now the concept and the factors driving medical tourism is quality of care, cost saving, cultural appeal, and among others, it can be summarized by MHCC, Malaysia Healthcare Travel Council, stated that why Malaysia, surprisingly, beat Singapore and beat Thailand. Some people thought that Thailand is always like the number one. Some people thought that Singapore has more foreign patients than Malaysia. Actually, the answer is no. They may earn more money. They may actually achieve higher revenue, but not in terms of numbers. So MHTC listed 5 key categories. In short, quality, safety, affordability, hospitality, and seamless journey. A quick one. This report is something that I would like to share. When the travelers, the healthcare travelers or patients comes to Malaysia, what would they look for? And this is actually the top rank, clearly. Research compiled, listed by MHTC consistently in the last 7 years. These are the areas. Yeah, of course, you probably say that it means it was almost everything. Not really, but people are very specific when they come. We eat the Indonesians, the Hongkies, the mainland China, Cambodians, etc. General health screening, cardiology, fertility, onco, orthopedic, and etc. These are the services. Try go to Penang. Look at the top 4 big hospital. You walk in there, you know that there's even the reception is also, they are Indonesians already, the staff. You go there, wife come for fertility, husband, got nothing to do, he also ended up doing a general health screening. Alright? Come for orthopedics, etc., dental care, of course, friends from Australia, or friends who migrated to Australia or PR in Australia still come back for his dental care. It's just impossible for them to bear that kind of cost. And when they come back to Malaysia, they try to do everything at one go. So MHTC had this quite unique report. See, after post-COVID, the highest peak pre-COVID was 1.22 million that Malaysia received the foreign patients in 2019. 2019, Malaysia had 1.22 million. That time, every private hospital were expanding. Every private hospital were expanding their marketing department. They were expanding their international team. Alright? Then COVID came. Everyone was affected. It took us a couple of years, And 2023, we scored and we achieved more than 1 million. 2024, we had a fantastic 1.3 million. 1.3 million. That is a very well done job done by all the private hospitals and medical centers. Not just the MHTC. In fact, the last couple of years, MHTC was really struggling trying to self-sustain. Alright? With a lot of issues and all that. But it was actually the individual players, the owners of the hospitals, the owners of all these private clinics and medical centers that went all out to go for their international roadshows. But that's because the seeds were planted years ago. Things don't happen overnight. Indonesians don't come to Malaysia because 3 years ago we worked hard for it. It was because 5, 8, 10 years ago, lots of effort were done by the respective hospitals, groups, and etc. And of course, with a lot of sharings, a lot of symposiums, conferences, a lot of engagements that the doctors, Malaysian doctors did overseas. Not just in Indonesia, but in the other places as well. And the top countries here, of course, I will list, they listed the top 10. Not wanting to say which is the top 3, but I'll tell the top 3. Rank number 1, from the 1.3 over million last year, 2024, more than 65% came from one country, it's Indonesia. Indonesia, in May this year, launched their Bali International Hospital at Sanur, Bali, a medical zone, trying to promote with the whole purpose. The president said that we want our Indonesians to stay back, don't go overseas, because there's millions of Indonesians going out to Malaysia and Singapore, and some went to Australia and some went to US for treatment, and the numbers are so huge. We want to retain, at the same time, enhance, increase, uplift the standard of the medical care in Indonesia. Let me tell you, my trip last month when I do a sharing in one of the medical conference there, most of the medical practitioners and companies there that I talked to, they also told me, oh, last 2 months I actually went to Malaysia for my own treatment. Despite them managing and owning and running a hospital. Am I joking? No. Hospital owners in Indonesia come to Malaysia for treatment. I watched to that sentence and that word. Hospital owners in Indonesia come to Malaysia still, even this year, for their own medical treatment. So what does that say? If they even own big, reputable, famous private hospitals in Indonesia, and yet the owners themselves come to Malaysia or Singapore for treatment. Try go for operation there. I think it's not an operation issue. Diagnosis itself is an issue. Get the same report, you probably have a different outcome. Alright, then ranked number 2, world and 3, respectively, is Singapore and also China. Don't be surprised. I'm happy. I'm okay with the currency, strong currency of Singapore, and I'm happy to look forward to the continuous good number of patients, Singaporeans or the Malaysian PR coming back to Malaysia, visiting Malaysia for all their medical needs. And a big growing market that cannot be ignored is actually the China. Not just the direct China into Malaysia, it is also the big numbers of the mainland China people who have already came to Malaysia to reside, to stay, to invest. I don't use the word work lah. They don't think they work in Malaysia. They think that they are just spending time and money and living, achieving, education or whatever for their children, etc. in Malaysia. Couple of days ago, I did a group of friends who actually was doing property real estate. They said, do you notice or not, suddenly there's a Park City, it's like a lot of China people. I said, now only you realize that. Other places also. Alright? And the numbers are not small. The numbers are not small. It's huge. It's a big community. Alright? Way surpass the Koreans already. To me, the Taiwanese and Koreans are no match anymore. No longer the main priority of the foreigners that is in Malaysia market. Okay, move on. This was published. Malaysia Medical Tourism, 2.27 B. Oh, how much did we get from here? How much did some good big hospital groups like Sime got from this percentage of revenue? IHH, how much did they manage to secure and tap on this? 21% growth year on year. This is, come on, 21%. Tell me what business gives you 21%. This is a low-lying fruit industry. It's no-brainer. This is the industry that we are in. And congratulations, you are in the right one. 1.6 million travelers in 2024. I dare not quote. MHTC told me before the CEO left, told me, hey, Vincent, we got 1.33 million. Okay, but published when publication came out is 1.6 million. I don't even dare to quote, but I just publish it and show you accordingly. And what's the target? Small 12 billion by 2030. And I'm really looking forward for Sunway's IPO. I hope they will do very, very well. And I think they will do very, very well in the IPO. Alright, just a quick one. 28th of May 2025, Malaysia Top Medical Tourism Ranking. This is in the NST. Dubai-based wealth consulting firm Nomad Capitalist ranked Malaysia as top destination. Health Minister jumped on it and quickly say, yes, we are still number 1. Pre-pandemic, and then we are coming back. And if regardless Indonesia what you do, actually we have the chance to meet personally the Health Minister in Indonesia earlier this month, September, we are still in September, right? Oh no, okay, yeah. There's no way they can catch up. We still have a good solid 10-15 years if Malaysia continue to do the right thing. Alright? Bearing certain assumptions about the quality of doctors and the aggressive Singapore trying to attract Malaysia doctors and all that, I put that aside. Alright, so let me share with you on what I think So when KL Wellness City was built, KL Wellness City, by the way, is owned by a group of medical doctors. You have not heard me saying this before. KL Wellness City Senang Berhad, the holding company that develops this 26.5 acres first healthcare and wellness city in Southeast Asia is owned by a group of medical doctors. Most of our shareholders was previously the shareholders that built the Tropicana Medical Center at Kota Damansara. Okay? Of course, eventually we got it publicly listed and then we sold it to Thomson Hospital. Alright? Why? We realized when we want to do international marketing, we couldn't. A single standalone hospital, we couldn't provide accommodation. We couldn't do it the senior living. The land was just too small. There's only that 600 beds max that we could get and do. We couldn't do we couldn't create the ecosystem. Hence off, after that, when we got public listed, we moved on. We sold the controlling stake to Thomson Hospital. We moved on, look for land, but the whole one condition, it must be in Kuala Lumpur. Cannot sit in Selangor. Alright, okay, sorry. If you are Selangor state government, I will tell you bluntly to embrace that why we chose Kuala Lumpur. Alright, it has to be in KL. Alright, the capital city of the country. Now, so medical tourism, what's there for us? Access to growing pool of international patients. I'll touch a little bit, because of time, I'll touch a little bit about the first hospital in KL Wellness City with a name called KL International Hospital, scheduled for opening Q4 next year. With the whole strategy and whole design of the hospital plan, purpose-built, driven towards medical tourism. Alright, international medical tourism. Alright, so what is it need for us? If you are, some will say, yeah, I'm just a GP, what has it got to do with me? You know, and some will say, yeah, okay, this is maybe more relevant for surgeons and all that. Talk to us. There are reasons, alright? There are a lot of opportunities to expand, integrate, and position, partner with us. And most interestingly, if you join us, attend, especially our Japanese omakase next Sunday, let me introduce to you our hospital C-suites from our ED, Dato Dr. Jacob Thomas, past president of APHN. He was a past world president for JCI. Of course, he was 38 years together with Sime Darby Group, Sime Darby Ramsey, Sime Darby Group, etc. And the rest, you will know why KL Wellness City was owned by a group of doctors and why and how we want Malaysian doctors to be our shareholder of our hospital before we opened. Alright? So, no, it's okay. Don't need to buy anything from us. Come and listen. Why and how you could be a shareholder of KL International Hospital. Just a hospital. No one asks you to go and touch about the other things. Don't go touch about residential, whatever. Maybe not relevant to you at all. But if you like it, you can buy. But the key thing is this. Would any hospital group relation invite you to be a shareholder? It's not proper for me to see a camera there. It's not proper for me to name any hospital. With any hospital that you think of, give you a chance to be a shareholder or not. I'm talking about actual shareholder of the hospital group. No. And there is, of course, the opportunity to be our pioneer doctors. Alright? Okay, anyway, it's 26.5 acres. This is how the whole city going to look like. Q4 next year, 2 big buildings is going to be ready. First of all, a 12-story high KL International Hospital with a capacity of 1,000 beds, sahaja. 25 operating theatre, sahaja. And the only hospital in Malaysia with a rooftop helipad for emergency medical services. And many, many other points that I would like to share, but I can't explain too much about the hospital right now. Adjoining it will be a full version of what you see in, like, for example, in Novena, Singapore. You have the private clinics, you have the ACCs. So if any of your groups aspire to own your own, set up your own ACC, ambulatory care center, or mini hospital, I call it, in a layman I call it mini hospitals, license, this is it. If you want to set up your own private clinics, you have the full support from the KL International Hospital supporting you to set up your own clinic practice. all group practice next to the hospital, part of the KL International Hospital. From all ranges of support, be it in terms of CCAPs, insurances, blah, 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 etc. Just imagine, the hospital group is the one that designed and built this medical tower with clinics, individual clinics, it's like the clinics that you set up, like some specialists probably need, say, I need a 900 square feet clinic only. That's all I need. Your OT already is there, I'm going to use your OT anyway. All right, things like that. So let us share with you a little bit more in the interest of time. But we do have a booth outside. I'll be here at my place there. My colleagues are around. But most importantly, I hope there's a chance that we can work together on two things. On clinical operations is the medical tourism. On your long-term investment, be our shareholder. Alright, sorry, this is not a pitch because I didn't issue a prospectus here. Alright, I have to make it clear. But the whole vision is this. We want it to be a project by doctors for doctors. Clearly, a project by doctors for doctors. If you've been to our gallery, you stand there, you look at it, wow, this is not a project that is actually, that you see on floor plan. It's a project where the hospital construction is already 70%. And I'm going to play one last video, just to give you an idea of what is the status of the project. This one, as of July, because now September, that will give you a little bit idea, and I look forward to seeing you next Sunday if you can. Otherwise, for the makan, but otherwise I'm still around, my colleagues are around, and we can have a chat. How do I play this? Can you? Is the video and with the music? Audio. Okay, then you may need to restart. Yeah, so we are 300 meters opposite across the road of Pavilion Bukit Jalil. And yes, we are quite near to Columbia Asia, Bukit Jalil, and INU. So that's, on the left is actually the hospital, on the right is actually the Nobel Healthcare Park. Currently 70% stage of construction. Targeting for CCAP to start the inspection in Q2. We give ourselves 6 to 8 months for CCAP's full inspection and approval, and Q4 planning for the opening. Construction above 70%. So there's a few prawns here. For those who have friends, not just yourself, who wants to join the hospital, we have started recruitment. Alright? A large big hospital, we need thousands of nurses and doctors and assistants and all that. For those who look forward to start and set up their own private clinics, these clinics are all CCAPs ready, compliant. Alright, with a full team ready to support for any renovations, designs, setups and all that. For medical or healthcare groups that is looking at setting up your own group practice, to have your own ACC, ambulatory care, or your mini hospital, I call it. We have a few levels that is ready. In fact, 2 months ago, one aesthetic group, listed company from Singapore, took up one whole level of 23,000 square feet to set up a whole aesthetic clinic center in our Nobel Healthcare Park. Currently, we have approximately about 129 specialist doctors who have bought the clinics. Who are they? I can't tell because they're still with some private hospitals. Alright? But you soon see them. Alright? And okay, so if you talk about generally, okay, I'm still in private hospitals, I'm still in part of the GP clinics, etc. There, the whole thing is it's an ecosystem. So imagine a hospital group, a healthcare group designs this, and you say that, hey, perhaps I'm keen to just buy the studio, the suites that is going to run as Airbnb for the international patients because the reward, the return is good. Or perhaps I would want to set up my pharmacy or my certain cafes or whatever at the ground floor of the hospital. Yes, it's for rental and it's for sale. Perhaps if you have friends who say that, well, imagine now, I would love to serve 200-300 clinics, in one whole building, in one whole community itself. Yes, this will be the right place. Right, so in short, we have the commercial, we have the residential, we have the etc. Our focus is very healthcare driven. All right, and if you want to venture a little bit more and explore to be our hospital's partner means AKA my boss, become a shareholder. All right, together with our current doctors, because we only invite doctors. For your information, the clinics are only open for rental and for sale to doctors, not non-doctors. All right. So yes, we would love to chit chat with you. Okay, that's all for my session today.
All right, ladies and gentlemen, please put your hands together and make some noise for Dato Sri Dr. Vincent Tiew. If you have any questions and so on, Dato Sri Dr. will be right outside. We have a KL Wellness booth there as well. And wow, what a way to start off with a makan invitation straight away. Perfect, I love it. Thank you so much. Thank you so much.